Evening, everyone. Welcome to the Aurum Meridian. I'm your host, Robert Hawkins, and your guide to excellence in dentistry, and hoping to help you find your next step towards dental excellence. My first guest and the first person to kick us off in this amazing new series, Dr. Amanda Seay. Dr. Seay, welcome. Thank you for joining me tonight.
Thank you so much, Robert, and I'm honored to be your first guest. So this will be fun. I love to do kind of these interviews where they're more about a conversation than it is, you know, just teeth. So
That's
I'm
right.
excited.
Yeah, it is. Dentistry today, I feel like, is really going in the direction of way more than just teeth. It's wellness, it's interdisciplinary, systemic. But I want to pick your brain about something that's related to that. None, well, we get clinical if you want, but we can get technical. But really, your journey from graduating dental school, starting out, and then going from being a published author, how articles you're at, I think over 80 published articles now. You've got two, let's call them empires, we'll call them, so imP.R.E.S, and you've got Seay. You're busy and you're building a massive new clinic, but I want to hear about your journey. How did you go from getting fresh out of dental school to where you are now?
Gosh, I mean, it seems so long ago, but at the same time, not really. I think I was really when I got to school and I was on my own, I had a chance to really choose a path where, my gosh, this is my career. Like this is what I'm gonna do. So I just believe that if something's worth doing, then it's worth doing well. And I just said I don't want to be mediocre at my job. I want to be excellent at my job, and I want to learn everything there is to learn. I mean, I didn't come from a family with dentists. I didn't know anybody that was a dentist. I knew nothing about dentistry, so I was really nervous about that. But I was really lucky to have met some great mentors through organizations like that I invested in, like the AACD, which is the American
Mhm.
Academy of Cosmetic Dentistry, the Coy Center out in Seattle, Washington. And so, I had these mentors, these teachers like John Coyce and other people that I met at AACD. AACD taught me, I saw some beautiful dentistry and I looked at it and thought, that's the kind of work that I want to do. But when I went to the Koi Center, having an individual relationship where with mentors like John Coyce and others, those are the people that really taught me how to think, not just what to do. And I think that that really challenged everything for me, to question everything and to become a lifelong student. And so I I just think, I was really fortunate to take that step and take all these CE courses early on, even though I really couldn't afford to do so, but because that really changed the trajectory of um, how I think and what I've become today, So I guess I would say the greatest gift my mentors gave me wasn't their technique, it was teaching me how to think.
Can you give me an example? Because I love that shift in mindset to go from I'm just going to practice dentistry to I'm really
Yeah.
going to affect change here. I'm really going to affect and level up my game in the way I treat patients. Do you have a specific example that you can think of?
Yeah, John Coyce is like my ultimate, you know, eagle up in the sky that I think has just taught me so much. But when I came out to the Coy Center, my whole intention was, I want more CE. I want to learn how to do these complex cases, and take them on. But when I came out there and I learned about risk assessment, it changed my world in the way I think, because dental school taught me you have a cavity of this size, you're going to put a filling in it. If the hole gets a little bit bigger, now you do a crown. And if it gets into the nerve, now you need a root canal. If it gets real bad, you take the tooth out and you do an implant. And it's like we're carpenters in a way. They're teaching us the mechanics, the
Yeah.
disease. Here's the disease, and here's what you do. And when I came out to the Koi Center, before we even got into what to do, it was about, you know, why does this person show up, have no plaque on their teeth? They tell you they brush their teeth 4 times a day, they floss, and they are constantly battling decay. And why is this person who has the worst home care in the world never does a thing and they never have an issue, right?
Hmm.
So what's the missing link? Is it really brushing and flossing that's going to save your teeth? Or is there, high risk patients, and why are they high risk? And before you just treat the hole and be the carpenter, how can we diagnose this? How can we change that risk for them, right? Because the goal is always to make them better, not worse. So now it's
Yeah.
looking at, what's the pH of the mouth? What's the, are they dry? I mean, there's so many elements to it. And I think that was the biggest game changer for me early on, as far as learning how to think, instead of just the what to do, which I felt like, I mean, I hate to say dental school really honed in on the what to do. When you're in clinics, you learn how to do a lot of techniques, a lot of different things. And yes, there's philosophy behind it, but it's not the
Hmm.
same. And I believe dental school is just the start of your journey. After dental school,
Hmm.
you need to continue on and take courses and to do things to, um, further your education and open your mind.
Absolutely. I love you said the word philosophy. What would you say? I mean, you kind of just went over it, but if you could summarize it, what is your philosophy when it comes to how you practice today? You're well known as being clinically excellent overall, but also for aesthetics as well too. What would you say your philosophy is when it comes to your day-to-day dentistry?
Yeah, I mean, I, I think I think that beautiful dentistry is always a goal, but beautiful dentistry begins long before you pick up a handpiece. Every decision that you make, you have to think about the preservation, right? My goal is always to try to be conservative, to preserve natural biology, remaining tooth structure, and if I pick up the handpiece, to ask yourself, does this give us the most predictable long-term outcome? Because just because you make it beautiful doesn't mean that you've done a service to the patient, right? Like, how can you make it beautiful without increasing their risk? How can you make it beautiful without making them worse or removing the biology that's already there, right? So I think that's my philosophy, and I think I spend a lot of time thinking about how I can make something beautiful, but preserving um, what they have in their mouth, because I want these teeth to outlive them. I mean, but that's the
Hmm.
goal, but you put it in a mouth that functions, that chews in an environment that's moist, maybe dry, drinking acidic things. And so you're really looking and thinking about so many other elements than just the end goal of creating a beautiful smile. So I would say minimally invasive
Okay.
dentistry that gives the most predictable outcome. And of course, to make it beautiful is part of it, no matter what you do, whether it's one tooth or 10 teeth.
Hmm. Right, right. And then as you go through and you look at how you're treating that patient, do you have sort of a set guideline, like sort of a template for a decision making when you're going through complex cases? And do you weigh kind of the trade-offs where maybe in a certain case the beauty, the aesthetics might need to be compromised because they have so many issues with, occlusion, other factors going on? Do you have a set protocol that you follow?
Yeah, I mean, I think the key for sure is to make sure that you have the diagnosis before there's any execution. I mean, that's the key, right?
Hmm.
And the more complex a case, the more I feel like I need to slow down to really spend more time in the planning phase than the treating phase. Because what can happen sometimes when I have these complex cases is, especially when you have a lot of experience and you've been doing it for so long, you're kind of like on autopilot. You're like, oh yeah, I
Yeah.
know what I'm going to do X, Y, Z. But then when you get complacent and you get comfortable and you feel like you yourself don't need a checklist anymore to hold yourself accountable, that's when the mistakes are made. So I'm huge on checklists for everybody in my office, not just for
Hmm.
me, for my team, for me especially, right? But no matter how much experience I've had or how many times I've done these cases, a checklist keeps it real for me. It keeps me accountable to slow down.
Yeah.
Um, and to really think and work through the case as if it were my first time, right? Because the
Hmm.
tendency is to do that. And I got really into the checklist thing when I read this book, The Checklist Manifesto, which I don't know if you've ever read that book
No,
before.
but I'm making a note right now. Yeah.
Yeah, and it was written by this neurosurgeon. Um, and one of the things he did was he went around to inner city hospitals that had the highest rate of infections and kind of observed what was going on. And he implemented something as simple as a checklist, right? And all in the checklist, all they so he didn't hire any more new staff. He didn't do more training. He just implemented a checklist, and the checklist was as simple as wash your hands when you first get in the room, wash your hands before you do this, wash your hands before that. Um, and the rate of infection went down tremendously at these hospitals.
Hmm.
But to back up why he even implemented the checklist is that he went around all these professions like high doctorate professions or all these different, high-end jobs and said how more mistakes are being made now than were before. And it's not because these doctors aren't as skilled or know what to do, but somewhere along the line they're missing a step or asking a key question. And so he tried to go find a profession or professions out there that made the least amount of mistakes ever. And they were
Okay.
pilots and people that built skyscrapers. And what they
Sure.
had in common is they had a checklist. So I'm
Hmm.
sure a pilot knows how to fly a plane, even a pilot that has flown for 30 years, but it doesn't matter if you're day one of the job or you're day, 30 years on the job, you
Hmm.
have a checklist. And so that's the premise of the book. It was really good,
Hmm.
but it got me thinking about the things that I do in these complex cases because I'll tell you, it's been probably 15 years ago. I did a full mouth case, and I mean, it was such a long, complicated case. And in between, I had some hygiene checks and came back and I got to my final impression and I looked at it and I was like, oh, I missed this tooth. It was a deep margin. Let's go do another round of impressions, go check some more hygiene. I come back, that impression's not good. So it's like just that kind of a day, right? I finally get back, I look
Hmm.
at the impression, I'm like, yes, it's amazing. I've got it. Put the provisionals on, clean everything up, check occlusion. I'm like, this is wonderful. And then I get a call back from the lab about 2 weeks later. This is a full mouth case, and he said, we're missing the bite registrations. And I was like, well, of course I took a bite registration. I mean, I know I'm supposed
Yeah.
to, I mean, especially for a full mouth when I'm changing the vertical and I do a tripod bite, I do prep to prep bite, I do provisional prep bite, I do provisional. I'm like, what? How could I? So I look in the
Yeah.
lab box. I'm like, surely we just forgot to send the bite registration. That must be it.
Right.
Uh, but it was. it was a painful, hard look at myself in that day to say, was I distracted? Was I busy in the running the practice? Did I get too comfortable? Did I forget? I mean, I don't know. It could be a million things. So I'm like, it's never happening again, number one. So checklist was installed, and that checklist has evolved and changed over the years. In fact, I just updated the checklist again. But I guess that was a very long-winded answer to how I approach complex cases. That slow down before speeding up. Um, Spend a lot more time in the planning than the treating
Hmm.
because, the treating, like I said, it's kind of like carpentry. Like you got your technique and your hand skills, you know what you have to do, but the planning of it, all those
Hmm.
pieces have to be put in place.
Well, I mean, the example that you described, I feel like is kind of an easy mistake to make, especially if you're on autopilot. You've been doing it a long time. So the
Mhm.
checklist is such a great recommendation. Tell me a little bit more about that. How, if I'm the patient and I'm sitting in your chair
Yeah.
and you're going to do, I've got a crazy bite and problems or whatever, and we're in the thick of it and you're doing all these different bites and preps, how does that checklist interact with the patient? Are you like, do you have a clipboard? Like,
Yeah.
give us a tidbit, a golden tip.
Well,
How are we doing that?
I actually teach a whole thing on this because, like I said, this form has evolved because it's not just clinical, it's administrative as well.
Hmm.
Meaning, I want to know what treatment coordinator has been working with this patient from beginning to end
Hmm.
because they know all the dates for the case, they know the lab with the case, they all those things. The scheduling of provisional approval, of seat date, of all that. Um, and then on there too, there's legal things like, did they sign the informed consent? Did they get their prescription signed and were they given? Do they have a consent to have a driver? So everything on this checklist is in preparation for that appointment and for us to be prepared for this patient, not just for that appointment, but from beginning to end.
Right.
So it's interactive, meaning there's parts on there that's for the administrative team, there's parts on there that's for the clinical team.
Hmm.
But on the day of like when we're actually doing the dentistry, this sheet lives in their lab bin. We have a huge box for big cases, and there's line items on each one. So, like, say, for example, day of prep, you have upper impression, lower impression. Now it says PVS impression or scan so that each line item either has to be checked or crossed off if you don't do it. Nothing's left blank to make sure that we're not missing anything. So my assistant will go through and will be like upper scan, lower scan, check, check, or upper PVS, lower, like I don't want to guess because I'm still digitalog. I'm not completely digital. And I think the more advanced we get, now things get more complex. I mean, 20 years ago, everything was analog. I didn't have to think about, did I take a scan or did I take an
Hmm.
impression? Now, well, there's a lot of times I scan things, but there are some times where maybe I took an impression. So our teams are getting inundated with more information and technology that's supposed to make their lives easier. But in a way, it makes things more complex. And that's when your systems have to be so dialed in, right? Because there's more room to make mistakes. So, anyways, the checklist lives there. That's the assistant's baby. And so she will call things out to me line by line. And patients like it too, because they feel like, wow, you guys are
Yeah.
like really thorough, you know?
Yeah. I feel like for me as a patient, absolutely. I'd be like, whoa, they are on it. They are literally dotting all the I's,
Yeah,
crossing all the T's because they do not want to miss a thing. So they don't have to call me back or something
yeah,
goes wrong. I really like
yeah,
that for sure.
yeah,
So don't be afraid to be out in public with that process, I think is a
yeah,
great takeaway for sure. For sure.
yeah.
Um, which brings me to my next question is how do you go from being good clinician to great clinician? What would you say is
Ooh.
that defining? Obviously, CE, we've talked a lot about, taking a lot of CE checklists. Is there something, how did you go from being good to great?
Um, I think curiosity is big, coachability, consistency. I just put three C's together. What I just said, curiosity, coachability,
Coachability,
consistency.
consistency. Yeah.
Probably could come up with another C, but I being an educator, I get to see a lot of dentists from all over, a lot of young dentists, but also I have older dentists that come to the courses too, but more younger dentists. And I see a lot of dentists that have so much talent, like natural ability,
Hmm.
talent, right? And I think talent gets you started. You might have a leg up, but even if you don't have that God-given ability, you can hone your skills to be better. There's no question
Hmm.
about that. But the people sometimes that have this talent, it's it's really humility that keeps people growing, right? So when I think about I see the people that come to our courses that you can tell are just great clinicians.
Hmm.
And when they're great clinicians, it's not because I look at their hand skills and I'm like, wow, you have amazing hands. They're the people that can look you in the eye at the course and say, how is your day? And I hear you have four kids. I have four kids too, or
Hmm.
just it it's just different. Or they're people that have been on this journey for a long time that stop and say, you know what, this is something that I really struggle with still. Do you have any tips of how I could do this differently? Right. So talent to me is overrated. Um, I think that you have to be curious. You have to be okay saying, I don't know, or seeking answers to somebody that might
Hmm.
know better than you,
Hmm.
and try to seek feedback instead of trying to defend what you're doing, right? Like, I mean, it's like I hear it all the time. I hear dentists that say, oh, well, composite breaks. That's why I don't do composite. Stop defending what you're doing. Ask why your composite's breaking, because it's not the material. It's probably the function. It's probably the occlusion, or maybe you're not
Yeah.
understanding it, right? So just like have some self-awareness, ask the questions. Um, just don't stop learning. Have humility to know that it is a journey, not a destination. And the best dentists, the best people are lifelong learners. You don't just stop learning when you achieve X, Y, Z. Like it's constant. And I mean, the industry that we're in, I mean, it's changing so fast that, I mean, I feel like more than ever now, it's hard for a young dentist coming out to be proficient at so many things because we
Hmm.
we have so many options available to us.
Yeah. I mean, there's two letters that are really dominating our industry right now. AI. Uh,
Gosh.
yeah, it. You need an AI to summarize and read and digest all of the content and systems and this, operating systems that AI is helping us with. There's just so much of it. Are you implementing any of that in your practices? What have you got?
So much. Um, it has put me completely out of my comfort zone. I mean, in every
It's a good.
way. Like every time I think I'm feeling really like, oh, I'm crushing it with digital technology and AI, there's something else that comes out, and I'm like, oh my gosh. Um, I mean, AI for sure makes things that we do so much faster, without a doubt, right? Digital
Mhm.
workflows make us more efficient. Um, but none of those things replace judgment. It, in And I think the future really belongs to the dentist that can embrace the new technology, the science, without, again, bringing back to the last question, without losing that humility, losing the compassion or the empathy, that AI can't do that, right? Digital
Hmm.
technology can't do that. So I hope that everybody coming, like with all the stuff coming out, that we're using it as an extra tool in our toolbox, but not to replace whole body dentistry in human beings, right? And I just think
Hmm.
also, aside from talking about the future of dentistry, the technology, I think the people that embrace the technology and don't just replace it with the thinking, that's how the future of dentistry is going to be elevated. But I
Hmm.
also am really, really passionate about the future of dentistry. I think you're starting to hear about the whole wellness piece, right? You
Hmm.
hear about it now, but it's been around, but somehow it's like this part of our body has always been separate from the rest of our body. And I think people are now starting to talk about how it's all connected.
Hmm.
Um, and so again, going back to not being the carpenter who just fixes holes and everything else, to find out, like, why do those holes help happen? And maybe there's more systemically, and how do I work with this person's doctor? How do I read blood work? We don't read blood work, but yet we take teeth out on people. I think that's the strangest thing in the world.
Hmm.
Um, and then they don't heal right, and people blame it on the surgeon, or maybe it was there all along, but we missed the signs because we never looked at the blood work to begin with.
Yeah.
So I think that wellness dentistry is the future. Without question, AI and digital is already here, and it's going to continue
Right.
to be there. But I think where excellence comes in is in the humans. It's us. It's
Hmm.
building the compassion, building the empathy, the humanity, and treating the person, not the tooth.
Hmm. Would you say how far away do you think, in dentistry is really bridging and creating that integration between medical and dental? Where it becomes a natural part of your first patient intake, their first appointment,
Yeah,
where it's expected of patients to say, I think now if a patient went in and you're asking about most of their health history related outside of their mouth, especially certain generations, they might say, why are you asking me about that? Like, why are you like, so
yeah.
I'm sure you're seeing that. Maybe did you want to touch on that? I guess for me, that would be what the definition of excellence in 5 to 10 years in dentistry would be. But what are your thoughts?
Yeah, yeah. I mean, so I've transitioned my practice over the past few years to do this. So part of what we want to have on our new patients before they come is we do want to have some current blood work from their primary care or their internal medicine doctor, um, because think about how antiquated really what we do is we've always taken a medical dental history, but we're relying on the information that they put on the form
Hmm.
is indeed what it is.
Yeah.
Check this box if you have high blood pressure. Check, list the medications you're taking. You don't know if they write even the right thing, but we're just looking at a piece of paper, reviewing the piece of paper and saying, okay, I reviewed
Hmm.
your medical history. Now I can pull the tooth on you, out on in your mouth. I mean, it's completely archaic, right? So it would be nice to have actual current blood work. And if not, we can send them for one with specific markers that we're looking for in order to do the dentistry that we're going to do to make sure that they heal properly. That we don't need to maybe prepare them ahead of time, maybe a few weeks ahead of time before surgery or anything else. Then the day of new patient exam, we do a saliva sample. We look at it on the microscope to kind of look at the different bacteria that's in their mouth, and then we'll send a saliva sample off to get a more thorough report to see, what risk categories they are in. Maybe they have high inflammatory markers and their body has a lot of these bacteria. Well, if we have certain bacteria that we know are going to be systemic issues, there's correlations, then I'm going to talk to their doctor because if they're having trouble healing somewhere in the mouth, I guarantee that they have trouble healing somewhere else in their body. Um, so again, we'll have our protocol of what we need to do to get rid of those bacteria to help them heal in the mouth, but it has to be in conjunction with their doctor because what good, again, this is not
Hmm.
separate. That's not, if I do everything I need up here, but all of it down here is not being taken care of. It's a tube. It all feeds one another, right? So um there's so much to that. And I mean, that's just kind of a little bit of what we do. And also, we want to make sure that we are supporting our patients the best we
Hmm.
can with that. Meaning, it's not, the treatment, it's what we do before to prepare your body for the treatment and what we do afterwards, too. Like this, if there's supplementation,
Hmm.
nutrition, sleep, breathing, all of that is part of your oral health and systemic health, right? So it's
Right.
it's not, again, being a carpenter, it's about looking at all those things. So I've had patients tell me nobody's told me about nasal hygiene. I'm like, yeah, we talk about oral hygiene, we talk about body hygiene, but there's something called nasal hygiene. You're supposed to clean your nose and irrigate it, not just clean it when you're sick, right? I mean, there's
Yeah.
there's so much to whole body health. So I think you see it everywhere. Influencers doing mouth taping, vibration play. Yes, I do all of that too, but no one's really made it where it's trickled into mainstream healthcare that way, that we're all connecting the dots and speaking the same language.
And that was my next question was, what does that interaction look like? So two parts. One, you get a patient who is, seemingly healthy, normal, no obvious signs of, otherwise. And they say, no, I don't want to give you all of that information. I just want you to fix my teeth or fix this cavity. What does
I
that
know.
interaction look like? And then number two, let's say they do consent to do all of that. Have you come across a situation where the medical doctor sort of questions why you need it and how have you handled that?
Oh, I mean, 100%. Well, let's start with the patient. Um, I think the hardest part, like new patients now coming in because of how we've positioned ourselves in the community and how we intake phone calls, they already know what to expect if they want to be a patient here.
Hmm.
So that solves that problem for the most part. Because there's some people who are like, what? How long is your new patient appointment? And no, I don't want that. Right?
Yeah.
That's okay. I'm fine with
Yeah.
that. I think the hardest part are patients that have been my patients for 20 years. And then all of a sudden now I'm like, hey, Mrs. Jones, I know you've been a patient here forever, but I've learned, new science and better ways to treat you. And I know that we've always just kind of struggled with, you know, keeping the tissues bleed. And I know you brush all the time, you go every 3 months, but I want to take a salivary sample on you. And I also would love to see some current blood work if you have some. And there's some that are like, oh, they're on board. They love it. They love that you're sharing what you're learning with them. And there are others that are like, how much is that going to cost? And
Yeah.
I just want my teeth clean.
Yeah.
It's been that way. It doesn't hurt. And that's the difficult part because then it becomes like supervised neglect. Because when you know better, you need to do better. And that's the tough part. You have to decide, do you have the uncomfortable conversation and just say, maybe we're not the right fit because, if you want to be a patient in this practice, I need you to get this done, or I
Hmm.
cannot treat you in this office. And so, there's a little bit of that,
Yeah.
but more amongst maybe existing patients that
Right.
are hesitant to grow and change with you.
Right.
They,
Right.
they want to go back to what they've had for 30 years and they want it to be exactly the same and not to
Hmm.
change. I mean,
Sure.
it's like the air polisher. Man, I think that thing is the greatest thing ever. And there are people that say, I hate it. I just want that little rubber polisher. And and it's just like,
Yeah.
okay, I mean, you know, not for
Fair enough.
everybody.
Fair enough. And for the medical doctors, how do you handle when they say, why do you need that? What does that interaction look like?
Yeah, and I think that's actually the hardest part. Um, because you never want to come from a place that sounds like you know more or you know better or you know different. So I try to just frame it and not, I mean, there's a lot that are very receptive to it. And they're like, oh my gosh, this
Hmm.
is great. I've never seen a salivary report before. This is
Hmm.
wonderful. There's some that are very willing to work with you, but the ones that aren't, I try to just come from a place of, hey, we have a mutual patient, and this is what I'm going to be doing for the patient. And if you have this, it would be helpful for me. And if you don't,
Hmm.
I'll keep you abreast of the things I'm doing, but I just try to share what we're doing for the patient. I try not to come from a place of why didn't you do this or how come you didn't do this? Because then the patient
Hmm.
also, they get upset too. They
Yeah.
think, well, I've been going to my MD every year and they always told me my blood work is fine. Well, fine for what standards? The bell curve of good, sick, and well people?
Hmm.
Or, you know, the standard of you who are you're perimenopausal, you're iron deficient, I mean, there's just, it's like we apply this blanket standard to everyone, and it can't be that way, and this is why I love functional medicine done right, because it is specific for the individual.
Hmm.
And we throw
Yeah.
those kind of,
Right.
standards away.
Can we talk about menopause for a minute? I probably didn't expect that question from me.
No! Yeah.
No. Uh, but how, because it's a hot topic, we actually just hosted
Uh,
a group here in Calgary talking all about menopause and the effects on oral health. What can you share some tidbits of what you've learned in terms of either your new patient intake and screening or how it affects oral health? Anything you can impart with us?
oh, this could be like a whole session in itself, but
Let's do it.
I mean, the whole, I think perimenopausal women, I mean, let's talk about physically, first of all. Like physically, it's a time in your life where your body is going through the most changes, and you could be doing everything that you've done the past 20 years and it's worked. You felt great, you've exercised, you've eaten well, and then all of a sudden you hit this wall and you gain weight, you lose muscle, you're exhausted, you're depressed, I mean, there's just so
Hmm.
many parts to that. And then there's like that's the physiology part. And so how to think that that doesn't carry through, that if you have bodily inflammation, that you don't have it in your mouth or in other
Hmm.
places. And so a lot of these women coming in, it's the perimenopausal women's a big population of the women that are coming with jaw pain
Hmm.
or, occlusion issues, or I mean, just like neuralgia, things that you can't explain, or all of a sudden they said, I've never had any problems, and all of a sudden now I'm getting cavities. Well, I mean, they're dry mouth. Why is that happening? There's so much change happening, especially in women,
Right.
perimenopausal women. The hormone piece is so big, and that
Hmm.
does affect the mouth differently. So you can be somebody who's never had any of these issues, any of these risk factors, then all of a sudden now you're experiencing, you know, symptoms on your teeth and your muscles and your joints. So there's a lot, and a lot of it sometimes is supplementation. It's
Hmm.
it's like nutrition of that's different than what you've always done. But this is you have to
Hmm.
work with a doctor too, that to look at your blood work. And this is not just a dentist issue. This is a
Hmm.
team issue. We have to do it together.
Right. So as we look at all of these changes, there's so many to navigate. Menopause, AI, people going on GLP-1s, feels like everyone is on a GLP-1 now.
Yeah.
How does that impact your relationship with all of your vendors? Like your, medical doctors, surgeons might be coming in for sedation, your laboratories. How does that impact and how does that change what you seek from their services?
Yeah, I mean, I think that we should be all working together for what's best for our patients. And it's
Hmm.
funny you bring that up because I had a friend today call me who had some surgery with the oral surgeon. And she said, he mentioned that I could get Botox in my masseters. I'm like, for sure. I'm like, that could definitely help you. And she's
Hmm.
like, should I go to him or should I go to you? And it was like, it's whatever is best for you
Yeah.
because I don't, we need to be working together for the patient, not for the benefit of ourselves. And I think
Yeah.
there's going to be a lot more crossing over if people are truly looking at whole body health, because
Hmm.
I already see it happening. Sometimes I see there are MDs that do salivary tests, but there's a lot of dentists that do salivary tests. So who's supposed to do the salivary test? So it's not, it's about having a conversation and understanding each other's work to say, hey, what's best and how can we do this for the patient? To make sure we're on the same page and that we understand the full picture, not just a chapter of it.
Yeah. Are you getting pushback on salivary tests? I mean, I feel like, not to trigger anyone, but after COVID, everyone was very familiar with salivary tests and the nose thing and everything. Are you still getting pushback because people are like, no, I don't ever want to do that ever again? Or,
Yeah, I not really. I mean, I think when they see their saliva on a microscope, and if I don't salivary test everyone. I know there's
hmm.
dentists that do. Um, But there's no questioning when you see saliva on a slide that's got tons of motility and just the high risk pathogens on there. Um, and you explain to them and you kind of show them, I give them forms to kind of show them what healthy ones look like, what moderate
Hmm.
risk ones look like, what high risk ones look like. And when they see
Hmm.
that they have high risk ones, I don't talk them into anything. I just tell them, based on what I see,
Right.
it would be wise to do a salivary test so we can really understand which ones, are prevalent and how we can treat them. And if they say no, I mean, they're just, it's not cost
Hmm.
because the cost of the salivary test is nothing. It's that they're not ready to hear or do anything different. And that's a choice. But for the most part, I don't get that pushback.
Right. Okay. Cool. Um, you've got two courses or two sort of educational pathways. Let's talk about those a little bit because they're
Yeah.
incredible. You've put a lot of blood, saliva, sweat, and tears into both of those, literally.
Yeah.
Tell me about, let's talk about imP.R.E.S first. You were here a year ago. I can't believe it's been a year ago already. You were with Dr. Wally Desi in the mountains doing imP.R.E.S with a demo.
Yes,
How's that?
yes.
How's that going? What's hot and what's new with imP.R.E.S?
That's right. I forgot you met him there in Banff. Super exciting. So imP.R.E.S it's a hands-on aesthetics curriculum that my partner and I, Adamo Antonio from New York, soon to be a South Carolinian, started. And we have 5 different courses, core curriculum courses from photography, rubber dam isolation, bonding,
Hmm.
composite, porcelain veneers, other things. And it's 2-day immersive hands-on so that you get to learn and actually do. Um, we're super excited because we are building a new facility right now that is also part of my new practice. So what that means is, when participants have gone to our courses in the past and they do these hands-on courses, of course, what they want to ask or see is, how do you do this in your practice? Like, what
Hmm.
does your operatory look like? Like, where do you store the rubber dam stuff, and how do you, um, inventory things, or how, like, they want to see the nitty gritty. And
Yeah.
now we have our courses and my practice is a part of it. We can have kind of live patients as examples. I could have my team there so that we can
Hmm.
extend the courses to have, like, the practice day to kind of see how that implements in actual real time. So exciting stuff, and we're hoping we have some cool things in store for the new facility too, that we're going to bring in some amazing speakers that aren't just us, but people to add to our curriculum,
Hmm.
other experts in different fields to bring some great education to the Southeast.
Can you give us a sneak peek behind the rubber dam? Any speakers that you can preview for us?
Yes, I can. I have 2 amazing speakers and educators from Italy,
Mm.
um, Dr. Salvatore Scalavino and Gaetano Pao- Paolone, and I have to say it right there.
Yeah,
But they both have amazing composite books, and they're going to do some anterior and posterior composite courses for us. And we have some others lined up, but we're going to kind of hoping to do like a grand reveal
for
soon
sure.
for all the people. Yeah.
Fair enough. Get that. And SeayWithin, your online platform. Give us
Yes.
give us the rundown there.
Yeah, so a big reason why I started that was, a lot of our people that go to our impress courses, they love it. They do their hands-on and they come back and they're like, oh my gosh, this went great. And I did 5 cases like this, but then I had this one really hard case. And it's like it I felt like there needed to be more follow-up in a way,
Hmm.
where you could have more community to keep, like, come with questions. Let's have a discussion. Let's go over more and more cases so that you've learned the philosophy, you've learned the technique. Now let's just dive in on case after case, like this patient just walked into your chair. How would you do
Hmm.
it? And what were the challenges? So I have basically, what I've done is I've made a mini lecture into almost every case that I've treated in my own practice. So I have a library of, I call clinical tip videos, of like 70 plus cases, and I keep adding more. And then I also have monthly live discussions, which are 1 hour discussions where you can join live Q&A, um, and do that. And I have guest speakers. Sometimes I bring my lab technicians on there because, and people really love that. So it gives them a perspective from the challenges from
Hmm.
designing to fabricating sometimes. Um, and then I have also digital format lectures if they want to just be able to rewatch
Hmm.
lectures in their own time. So a lot of things, articles, few cooking recipes on there. It's kind of like a hodgepodge of my life, all these little things rolled up into one and
Okay.
just
Okay, so let's talk about the cooking recipe. Let's move off dentistry for a hot second here.
yeah, yeah.
What is the go-to recipe? You've got new friends, family come over, you're like, I got to impress them. What's the recipe you're making, and is it on SeayWithin?
Not on SeayWithin, because SeayWithin, what I try to do is like simple, easy recipes because I have 4 kids and I want to make
Sure.
something delicious.
Yeah.
if I want to really wow people, then it's usually a more intense like preparation. And it's usually Asian because I feel like it's nice to be able to cook something that maybe a lot of people have never tried before.
Yeah,
Um, so it can vary, but usually if I have more time and I have guests, then I'll plan more elaborate meals. But the recipes on SeayWithin are they're amazing meals. They're like staples in my house. They're the meals that I get home from work and I have 30 minutes to an hour to put something on the table. And my kids made the meals with me and the on the videos too for most of them. So
I love that. Yeah, get
yeah.
them involved. Yeah, awesome. I'm going to move to our rapid fire segment now.
Ooh, okay.
I'm calling it the Wisdom Bites. It's a working title.
Okay.
I'm going to chew on it a little bit. One dentistry pun. I got to get that in there. So, question number one. First thing that comes to your mind. Um, what is one mistake that taught you something valuable?
Um, I would say that I would not assume that I have all the answers. Um, or again, it kind of goes back to just thinking like you're too comfortable, you know all the answers because you've done it so
Hmm.
many times.
Hmm.
Um, so I told you the bite registration story.
Yeah.
So
Right.
it's don't ever get complacent that you think that you can't be held accountable for even the simplest of procedures because these people are coming in and trusting you with their care, with their health. You're doing irreversible work sometimes on them. You're removing tooth structure, so like you're not above holding yourself and everybody in your team accountable for
Mhm.
everything you do. So, don't assume you have all the answers.
Awesome. Number two. What's something in dentistry you think we're getting wrong right now?
Um, I think again, I think we're restoring teeth before we're diagnosing people. It's like all over social media. I mean, all we see are beautiful before and afters and comments, the descriptions of the cases aren't anything other than porcelain veneers. Like, let's talk about the why,
Hmm.
or like how did it get to that place, right? And I think I love and hate social media, right? We celebrate beauty, we celebrate the beautiful dentistry,
Hmm.
the photos, everything else, but we're not celebrating um, what long-term health looks like. I mean, I see young doctors look at these cases where someone put 28 porcelain restorations and they're like, "You're amazing, doctor. You're a magician." Really? What do those preps look like under there? Show me the preps because let's stop celebrating that. Let's talk about health. Let's talk about diagnoses. Let's talk about preserving teeth through orthodontics or additive dentistry or better planning. Let's talk about that and show the beautiful dentistry. And so I try. It takes a lot of time, but I try in my social media to not just show a before and after. I try to show preps all the time, rubber dam inserts, the pre-ortho, the thought process, the crown lengthening. Like I try to show all the things that led me to that place so that no matter where you are in your journey, especially the younger
Hmm.
dentists coming out, that they're not enamored with, oh, look at her after photo, but they understand this is what responsible dentistry should look like.
Hmm.
This is long-term health. This is predictable outcomes. Let's not just like the beautiful photo, you know?
Yeah.
So,
Yeah, exactly. I love that answer so much. That speaks those pictures, and when you can document that over 10,
yeah.
15, 20 years and the teeth still look incredible, the patient is still healthy, that's what matters.
Yeah.
Absolutely.
Yes.
Okay, next one. Outside of work, what is one thing
Oh,
that makes you better at what you do?
my kids. Raising four children, it has taught me patience. Um, it's taught me how to listen because everyone has a different story. I mean, I have four kids, they're all different children. And even though I have tried to just parent the same way, I
Hmm.
realized that I gotta pause. I gotta really seek to understand and listen because I might have to adapt
Yeah.
how I speak, how I am around them. And I think that's carried through and hopefully in how I treat my patients because I mean, nothing's harder than raising your own children, I can tell you that. Um, so
Hmm.
so I think being a mother has taught me a lot of different things. My faith is a big part of what's made me better,
Hmm.
both outside and inside of work. Um, fitness is teaches me discipline,
Hmm.
consistency. When I show up for myself, I show up for other people better. So, um, it's funny because when you think about and my husband actually is like everybody loves my husband. You met David, didn't you?
Me too. Me too.
Yes.
Yeah,
Okay.
I'm still waiting for his skincare. I'm still waiting
Yeah.
for his skincare routine.
Right.
So,
So everybody loves David because David's got just amazing energy and aura around him,
hmm.
right? He he had he always talks about success and he goes, a lot of men I talk to talk about success and success to them, when they say success, they talk about financial success. He's like, but success is a lot of different things. It's success in faith, in fitness, in love, in all these things. So
Hmm.
I don't think there's the one thing that outside of work's made me better, but yes, being a mother, because raising children involves all of those things as a human being to be able to try and be all those things, to love on these little people that way. I think you have to have kind of all that, and hopefully that trickles into how you are as a dentist when the patient walks in the door, because patients don't, how many times do you have patients that will transfer over or they come to me for the first time and they say, oh, I just loved my old dentist so much. I've been with them for like 30 years. They were the best. And you look in their mouth and it is like the worst dentistry you've ever seen. And so my point is that, yes, we're striving as dentists to be the perfect dentist, to do excellent work, to do all these things. But at the same time, patients probably won't remember this perfect margin or perfect filling more than they will remember how you make them feel, as a person, or how you truly see them as a human being when they walk in the door. So I think about it all the time when I get a new patient that's a transfer again, and the hygienist comes to get me, and she's like, "Oh my gosh, she's the sweetest new patient, but she loves her old dentist, and she is a mouthful of stuff." And you're just like,
Yeah.
how does that happen? Because they fall in love with the person and how they made them feel.
Hmm. Yeah. The people skills. Absolutely. Yeah. Um, Last question of the wisdom bites. What's one piece of advice people can carry with them from this conversation?
Oh,
It's a tough one.
if there's a theme about all of it, I guess invest in relationships and people. I know we're dentists, and yes, maybe there's teeth in there, but you can do the most beautiful restorations in the world, but invest in relationships in the people that you treat and also the team that you work with each and every day, because it makes your profession so much more enjoyable when you have a team that surrounds you that's happy, right?
Hmm.
And that's investing in the people. So, I'm not the easiest person to work with, and that I require a lot of things. I mean, I have checklists for days, and a new hire coming in might be like, oh my gosh, this woman's losing her mind. She's going to be so difficult to work with. But when you invest in the people and explain to them the why of what you're doing, when you teach them also how to think, not what to do,
Hmm.
it changes the story. It changes the reason that you're there every day and why you're doing it. And it just makes your job so much better.
I love that answer so much. It can make or break your life in personally or clinically as well too. And it comes back to the Simon Sinek, start with why, right? If they're on board with why you're doing it, why they got into dentistry.
Look, I forgot about that book. That's a good one.
Yeah.
Yeah.
Well, and I was going to ask you as well too, because you said off the hop, right, an hour ago, you said when you got into dentistry, which is you don't hear this very often, but no one in your family was involved in dentistry. So I guess I want to ask you, not the last question, I'm going to keep going, but why did you get into dentistry? If, no one in your family was in dentistry, you said you were nervous as heck, it was something totally foreign and new to you. Why? Why dentistry?
It sounds really trivial, but I actually was the person I am today is not the person I was at the point when I had to decide what I wanted to study. I had no idea actually. And I I had my best friend from seventh grade and still my best friend to this day, 30 something years. I lived with her family a few summers when I was going through a really hard time in my personal life with my family. And so I wanted to be just like her. I wanted to have a family just like hers. And so when I was getting ready to finish college, near halfway through college, and I'm like, "What are you gonna do?" And she's like, "I'm gonna be a dentist." I'm like, "That sounds great. I'll do that too." And I mean, my parents didn't even take me to the dentist regularly, and I had knew nothing about. When I tell you nothing, I knew nothing. Even when
Hmm.
I interview at NYU, which is where I ended up going, I remember coming there, and there were about a dozen of us for lunch, and the dean said, go around the table and introduce yourselves, and if there's any specialty that you are interested in, and just like 30 seconds each person. So I was one of the last people to go, and I'm listening to everybody, and everybody's like, I'm so and so. My dad's a periodontist, and I'm thinking about going into that too. Or somebody's like, oh, I'm thinking about endodontics. And I was like, periodontics. What's periodontics? I'm like, endodontics. What is that? Like I knew nothing. And I'm like, oh my gosh, maybe I shouldn't go to dental school, and
Hmm.
so I really that's how I became a dentist, truly and honestly.
Well, I think so. Did she end up becoming a dentist?
Oh yeah, she's a Coice graduate. She became accredited with the ACD, and
Who is it? We need to give her a shout out because she
I,
inspired you. Who is it?
Erin De Palma, and it's really cool, because it's another long story, but the long short of it is that she's the one who got me into dentistry. Um, but then when I got into dentistry and I chose my path where I was like, I'm gonna be good at what I do. And that's when I did my CE journey, and I
Hmm.
became a mentor, the Coy Center, clinical instructor, got accredited, got fellow, did all this stuff. And Erin and I were always friends, but Erin stayed on a different path. She was just in her private practice. She had her head down. She was working, having kids. And then one day she said to me, she said, why haven't you taken me along on this journey with you? Why, like you love it so much, and I don't feel like I love dentistry like you do. Why haven't you taken me along? And I mean, I just broke down in tears because I just said, because I always felt like you were the one that led me, like you were the one who's decided to be a dentist, and you always had the good grades, and you always had the family you had. And I just never felt like I would be that person that she would ever look up to or say, show me the way, right? I
Mhm.
always felt like to her, she was the person that would show me the way. So, anyways, we had this raw conversation, and then and I was like, of course I'd want you to do this. And so she went through it, and darn it, she didn't do it in like less than 5 years, and accomplished all those things. But life's just, it's crazy how it works. But
Well, Aaron, you rock. If you're listening or watching this, and you made a whole bunch of new fans from this session, so
yeah.
thanks for thanks for being that inspiration, not only to Amanda but to the rest of us as well too. Um, Next week, my guest next week is also a friend, and you know him well, Dr.
Yeah.
Chad Kasparowski.
Yeah.
Give us a funny story about Chad.
Chat. Well, first of all, if for those that don't know him, he's like the dentist to the NFL, right? Or
Yep.
what's the specific title?
He's team dentist for the Washington Commanders.
That's right. Okay. That's who it is. Okay. Chad. All right, real quick. I don't know how much time we have left, but
We got as
la-
much time as you need.
last summer we were in a dental trip in Rome, and we got put into scavenger hunt groups, and he was in my group. And so when the timer hit, everybody starts to scatter, and you're in your groups, and you have an hour and a half to run through all these clues, find them, and each clue would lead to a next. And each clue had a certain number of points. So at the end of an hour and a half, based on the things that you achieved, you had to get photos of all these things, and some things had higher point values than others. So you had to decide, do we invest the time to try and get this 20-point photo, or do we just do the low-hanging fruit and do a bunch of little like 1-point things, but they're easy?
Hmm.
So we're running around, and we the big point picture was to take a picture with a priest. We're in Rome, so getting a picture with a priest should be mm, relatively easier than
Yeah.
it would if you lived in America, right?
Hmm. Yeah.
Only that our group, that was one of the last things that we decided to go for. So by the time we found a priest, we saw him, and we're like, Chad's like, priest. And he runs, and I'm like, okay, go get the picture of the priest, and I'm gonna go over here and get another photo or something. And then we come back together, and I was like, oh my God, we're gonna totally win. Like we got like 15 points because we had a picture of the priest. And he's like,
Hmm.
you don't want to take a picture with me. And I'm like, what? I'm like, what priest?
Why?
What priest doesn't want to take a picture? Because he's like, I don't know. And I think it was because the other scavenger teams probably already harassed him and probably like, just mowed him down and took pictures with him. And we were the very last group, and he probably had just had it, and he said enough. So
He was sitting at the first table at the cafe outside the door, and they all found him, right? And you were the
right,
last one to, yeah.
right. So we did not get the photo with the priest.
But did you win the scavenger hunt? Did you get all the other points?
No, I think we came in third place, which isn't bad, but no participation trophies for me. Like it's first or nothing. So we were a little
Well,
disappointed.
to me, it sounds like it's Chad's fault because he didn't get the picture with the priest. Probably would have won if he had sealed the
I
deal,
know.
right?
I feel like it was Chad and Christian together, but I'm not sure. Christian Yates, which it's a little fuzzy because our group had to split up. And I do know. that it was, I don't know if Chad and Christian were together or is he by himself, but anyways,
Hmm. They both say it was the other one. They're pointing at each
yeah,
other like Spider-Man. Yeah. So,
yeah.
um, hey, this has been an incredible conversation. I really want to thank you for your time. You're incredibly busy with everything you got going on, building the new center. So, thank you so much. Any parting words before we sign off for the evening?
Tell me parting words other than thank you. Thank you for having me. Just really enjoyed it, and I can't wait to tune in and listen to the other speakers that you have.
Excellent. Well, I hope you do. I hope you can find the time. I know you're smack in the middle of hanging drywall and building your new facility.
Yeah.
So, no offense if you can't make it. But please, if you're listening to this, please check out Dr. Amanda Seay and her imp.R.E.S courses and SeayWithin. That's SEAY within.com. And you can follow her on all of the main social media channels. And please connect with us, the Aurum group as well too. All of the main social media channels. And until then, I hope you found some guidance with your Meridian, and we'll sign off and we'll see you next time. Thank
All
you.
right.
Thanks,
Bye.
Dr. C. Bye bye.